Good evening and welcome. I'm Chris Parnell.
Reporting from Moscow.
Tbilisi.
Times Square.
May your dreams be your only boundaries in life.
Hello and welcome to this week's edition of GHS-TV's award-winning talk show, Crosstalk. I'm your host, Renee Mann. Each week in this time slot, we take a look at different issues, personalities, and events that affect you and our community. As a parent, you warn your kids about the dangers of drugs and alcohol, but are you prepared to talk to them about a whole new range of addictive behavior? For generations, teens have struggled with chemical dependencies, cigarettes, chewing tobacco, alcohol, and illegal drugs. But not all addiction is chemical in nature. Today, we'll talk with local doctors and counselors about the different addictions affecting teens. Later, we'll discuss ways to treat the addictions with representatives from Fairhaven Treatment Center and Bradford Health Services. But first, Dr. Jeffrey Hamsley of Hamsley Consulting is here to talk on the troubles affecting our teens. Thank you for joining us, Dr. Hamsley.
Thank you for having me.
Dr. Hamsley, what are some of the most common cases of teen addictions?
I think the most common is going to be still cannabis, marijuana, and also video games. I'm seeing a lot of that in my practice.
You mentioned the synthetic marijuana. What is synthetic marijuana?
It has a lot of trade names like Spice and there's K-Pow. It's usually sold in like a head shop where you get paraphernalia, and it's manufactured marijuana. It's not grown, and it's like chemical compounds, and when they outlaw a certain strain of it, will go back into the lab and make another strain so that they can go by the laws and things of that nature, and it's really an unknown.
And illicit drugs, they go up as you head in from an 8th grader to high school. Why do you think that is?
What do you mean go up?
Oh, I mean illicit drugs, they go up in addictions.
Oh, I think part of that is just as a young person starts to drive and starts to have a part-time job and starts to make their own money, they have more freedoms, their parents give them more freedoms, and they have more opportunities too.
Is that why you think more teens are prone to addictions?
Yes, I think it's the freedom. Also with the cell phones and the video games, young people have more freedom and more, they have more communication, they have more mobility, things of that nature.
Some researchers believe that brain development transitions from a teenager to an adult brain. This is where mental diseases can occur. Can you elaborate on that?
As far as when they make the transition from, say, preteen to adolescent to adulthood, well, once again, we're living in an instant society where everything's happening so fast with communication, with television, with the internet, with cell phones, and I think we're putting adult pressures on young people at a much earlier age. I know people can start working at an earlier age and things of that nature, and I think it leads them into sometimes this pressure to be an adult too soon. I think it's important for young people to enjoy their adolescence and have fun and not have these pressures so quickly.
In recent years, it seems like more teens are being treated for addiction. It also seems that some of these addictions are more obscure. Why do you think that is?
I think some of them are obscure because, especially when you get into pill addiction and things of that nature, if a young person, say for instance, legitimately has ADHD or ADD, They may be prescribed Adderall or Ritalin or some type of stimulant. They may share them with their friends and use them to abuse them. So I think a lot of times it's not like the olden days where someone would first smoke a cigarette and then they would drink a beer and then they might try marijuana. I think there's other paths. Once again, there's a lot of freedom.
And doctors are getting so much better at diagnosing these addictions.
I think they are. I like to think that the medical community is joining with the mental health community and being more aware. I know I've talked to medical doctors who refer patients to me, and they're acutely aware that drugs like Adderall and Xanax have an abuse potential. And one thing it's real important to understand, drugs aren't bad. I think sometimes we feel like drugs are bad. We talk about drug addiction, we talk about drug abuse and how it's harming society. But if a drug is taken for what it's meant to be taken for, it has a legitimate use. So if someone genuinely is anxious, taking Xanax is not necessarily wrong. If someone legitimately has ADD, taking Adderall is not wrong. Now, when it's given to another person who doesn't have that condition and they're using it for recreation and they're using it for euphoria, then you crossed over a line there.
Switching the topic, sleep deprivation is common in high schoolers. Can this skew their decision making and maybe possibly lead to other types of addictions that they could?
I think so. It's very, very important for young people to get their sleep. It may sound trite, but HALT, H-A-L-T, don't allow yourself to get too hungry, too angry, too lonely, or too tired. I know from having children, and my children are much older now, but when they were young and they were little, if they were tired and hungry, they would misbehave. So you would give them a snack and give them a nap, and then my wonderful children would reappear again. Adolescents and adults are the same way. If you don't get a proper amount of rest and if you don't eat right, it affects your mood, it affects your level to deal with stress. You become more irritable more easily.
Dr. Hamsley, let's talk about peer pressure. We all know it has a great effect on what teens do. Would you say it's kind of a gateway to addiction?
I think so. I think a lot of young people start using drugs and alcohol or start engaging in behaviors that they wouldn't normally do because they want to be cool and fit in with the other kids at school or in their peer group. And I think it's really important for young people to stick true to their origins and to try their best not to allow themselves to fall into that trap.
Could you go deeper into the psychology of that?
Well, I think most human beings have an innate moral compass, a fundamental idea of right and wrong. I know young people sometimes will have a religious background from their parents and things of that nature. And I think when you get away from your origins and get away from your foundations, that you make poor choices. I think one of the big things I'm trying to teach my children is decision-making skills and problem-solving skills. I've learned that every decision I make is going to have either a positive or a negative consequence in the future. So I want to make sure that here and now, one day at a time, that I make good decisions. And I'm trying to model that behavior with my children. Now, when I launch my children out into the world and they go to school and they go to work and they go to college, hopefully they're taking that with them. But I can't control that. I can't monitor that. I have to trust that they're going to make wise decisions.
Dr. Hamsley, thank you so much for coming on our show today and giving us this valuable information. Unfortunately, we're out of time.
Thank you so much.
If you want to contact Hamsley Consulting, call 901-209-4874. We've got to take a break. When we come back, we'll delve deeper into some of the more prevalent teen addictions with Dr. Lisa McCann of Fairhaven Treatment Center and Alan J. Katz of Rediscovery Counseling and Coaching. Stay tuned.
I can't believe we broke Old Man Hennessy's window.
Correction, dude. You broke. I just threw the ball.
This is really bad. What are we gonna do? Dude, kiss your life goodbye.
Yeah.
Sorry, kid.
Keep smiling, keep
was an accident, and we can fix the window. I'll come with you.
GHS-TV has a new website. You can now view any of our shows on our new media pages. Or check out the latest Wake Up Germantown or Red Devil postgame. As always, we're streaming live 24/7. Just visit ghstv.org today.
Hi. Hi.
Welcome back to this edition of Crosstalk. I'm your host, Ernimi Mam. This week we're discussing teen addiction and treatment. Joining us now on the show are Dr. Terry McCann of Fairhaven Treatment Center and Alan J. Katz of Rediscovery Counseling and Coaching. Thank you both for joining us today. Dr. McCann, let's start with a startling statistic. In the U.S., more than 30 million people suffer from an eating disorder at some time in their life, including anorexia nervosa, bulimia nervosa, and binge eating disorder. Can you explain the difference between these three disorders and what causes them?
Sure, and let me say to start with that there's some fluidity in that one person may have each or two of these diagnoses over the course of time. So there is a lot of same person as they mature, changing diagnosis a bit. Anorexia is generally related to restricting food and low BMI, really restricted calorie intake. Bulimia tends to be related to eating large amounts of food and then doing some kind of compensatory behavior to get rid of the calories associated with that food. It could be purging, but it could also be excessive exercise or laxative abuse. And then binging, we're all more familiar with, I think, which is just very excessive calorie intake in a restricted amount of time to the point that the person feels uncomfortable, either psychologically or physically. And as far as the causes, that's probably a whole segment or a whole day, but I would say that they're all biopsychosocial causes for eating disorders and that there's a biological component, certainly a psychological component, and social component, a media component that really can work together as a perfect storm to create disordered eating or an eating disorder.
Why do you think eating disorders are more common in teens?
I think that, for one thing, the diagnosis doesn't go away, so it's just diagnosed in teens. And there is a lot of social pressure for teens to look a certain way or be a certain way. So it's social pressure and just early diagnosis.
Is it more about control or body image?
For different people, it might be different factors that really contribute to the eating disorder. It does become kind of a symbolic control of the environment in a lot of cases. And then for some people, it might be more related to body image. But usually you see both of those factors in a single person.
Dr. McCann, how does media play a part?
That's, when I'm talking about biopsychosocial components, certainly the social pressure to be thin is real, and it's very much a part of our culture and fashion and very prevalent in junior high, high school. I would say it's a component of an eating disorder, perhaps not sufficient to create an eating disorder without the other components of maybe a psychological or biological predisposition.
Mr. Katz, the internet can be a seductive place, especially for today's LinkedIn teens. Can you give us an overview of internet addiction disorder?
Sure. It's actually not a DSM official diagnosis yet, but we're working on that. But internet addiction, I guess to define addiction in general, is a compulsion or obsession that somebody has that begins to affect their money, their relationships, things like that. And so something they do over and over again, they think they can stop, but they don't stop. And so the idea of video on the internet is just in itself very addictive.
And what are the different types of internet addictions?
Well, there's texting, there's sexting, there's pornography. People get involved in chat rooms, things like that. And there's video chat, and there's just texting chat, and it all just becomes very addictive and something that people can't stop. You know, they'll say, I'll just do this for 5 minutes, and then they end up spending hours.
With so much technology all around us, and most of it associated with the internet, many of us don't realize that we're addicted. So what are some of the signs of internet addiction?
The signs are actually internet addiction, especially pornography, is very similar to cocaine, where you're constantly trying to reach a high, you're trying to find something that's going to continue to be more stimulating, and you never really reach that, so you just continually stay on there for hours and hours. So that's one of the things.
Who do you think is more at risk, boys or girls?
That's a tough question. I think boys are at risk for pornography especially, but I think girls are also at risk for the sexting, and because both of them are looking for connection. It's really a problem of wanting a connection with somebody, and especially if they're lonely and maybe not getting that connection from their parents, then they're looking outside of there for other connections from some other people.
Dr. McCann, eating disorders are typically associated with teen girls, but they can also manifest in boys too. Is there a difference?
In the way they manifest necessarily? No, there's not a huge difference. Anorexia is anorexia, and bulimia nervosa is bulimia nervosa. Certainly the causes might be a bit different. Males who play certain sports are at higher risk for eating disorders, but it does present the same kind of physical complications and a lot of the same psychological etiology.
There are many misconceptions about eating disorders. Can you talk about a few?
A huge misconception is that someone with an eating disorder looks unhealthy. They might look unhealthy, but they might not look unhealthy. Because eating is so disordered and it's so common in this culture, things appear normal that aren't normal. But a preoccupation with food, calories, exercise is an eating disorder or disordered eating. There's preconceptions about certain populations not having eating disorders, but that's not true. Eating disorders cut across all ethnic, racial, cultural stereotypes.
Dr. McCann, Mr. Katz, thank you so much for joining us today. Unfortunately, we're out of time. The information that you provided for us today was really eye-opening for our viewers.
Thank you.
Thank you.
To contact Fairhaven Treatment Center, call 901-244-4304. And to contact Rediscovery Counseling and Coaching, call 662-883-4520. We have to take a short break, but when we return, hear what can be done to treat teen addictions. Matt Myatt of Bradford Health Services and Angela Quadrani of Fairhaven Treatment Centers will join us on set.
Tell me what can I do today? Hey, let me get that for you. Everybody needs a helping out. If that ain't what it's all about, tell me what.
Thank you, young man.
What can I
No problem.
What can I do today?
Courtesy. Pass it on.
I got it.
A message from the Foundation for a Better Life.
GHS-TV has a new website. You can now view any of our shows on our new media pages. Or check out the latest Wake Up Germantown or Red Devil postgame. As always, we're streaming live 24/7. Just visit GHS-TV.org today.
Welcome back to this week's Crosstalk. I'm your host, Durnimi Mann. Today on the show, we've heard about the different types of teen addictions, but what can be done to treat them? Joining us now are Matt Myatt of Bradford Health Services and Angela Quadrani of Fairhaven Treatment Centers. Thank you both for joining us today.
Thank you for having me.
Ms. Quadrani, you treat eating disorders at Fairhaven. Can you walk us through the treatment services?
Sure. Fairhaven Treatment Center for Eating Disorders is right now females only, and we offer residential treatment, partial hospitalization, which is known as PHB, and intensive outpatient, which is IOP. And right now we're building on an adolescent program as well.
What is the intensive outpatient program?
Intensive outpatient program usually runs from about 10 a.m. to 1 p.m. and our clients will come in and they'll receive different types of treatment, usually with a registered dietitian, one of their primary therapists, and they'll usually do a group as well.
About what percentage are the patients you see teens?
Well, right now we're building on our adolescent program, so the range of ages that we see can range anywhere from 14 and up. And 14 is the youngest that we've given treatment to.
Ms. Quadrani, when a parent discovers their child's eating disorder, how do you determine whether inpatient or outpatient therapy is the best treatment?
Well, that's a process that they'll come in, they'll do an initial assessment, they'll sit down with a therapist and a dietitian, and they'll determine the course of treatment from there.
Some parents may think going to a treatment center is too extreme. What do you say to those who are hesitant?
For me personally, I would say that I would go to any lengths for treatment over an eating disorder, and it takes a multidisciplinary team sometimes to tackle that eating disorder. So residential treatment is a really good option for those that are suffering from an eating disorder.
Mr. Myatt, at Bradford Health Services, you're known to use chemical treatment in addition to therapy. Can you explain what goes into chemical treatment?
Well, sometimes they might use, especially in the adult program, Suboxone type treatment, which is an opiate antagonist, that allows them to do an outpatient detox situation.
Can you compare the benefits of therapeutic treatments and chemical treatments for disorders and addictions?
Yes, what we use once they detox from a substance, a lot of times that's done inpatient and outpatient. Of course, we have psychiatric medications that may go along with a co-occurring mental disorder and a substance abuse issue, but then we use Vivitrol to help where they can't get any benefit of taking an opiate in that, and also helps control cravings.
Do teens respond better to therapy or chemical treatment?
Well, really the talk therapy and that, and then if you use them together, research shows that you have better outcomes. But most of the time it is just talk therapy, especially with the adolescents. It's more of the talk therapy at this point. We see more of the chemical treatments and using talk therapy sessions more in the adult population with my experience.
And what types of addictions do you see at Bradford?
We see all types of addictions. Of course, we're dealing with alcohol and substance abuse as a primary diagnosis with ours. We're seeing a lot more of opiate abuse. Heroin is really big, unfortunately, in this community and throughout the United States today. All the way from marijuana, alcohol, benzodiazepines, and like I said, the opiates, pills, and heroin is really bad in our community.
Ms. Quadrani, what other types of addictions do you see at Fairhaven?
We treat eating disorders as a primary diagnosis, but we also are a trauma-focused therapy, so anything dealing with trauma as well.
You offer a confidential help hotline that's open 24 hours a day. Have you seen an impact that the hotline has had on the callers?
Yes, when they come to see me, obviously things aren't going well at that point in their life, and it gives them a 24-hour a day when they have a situation to find out how to get help. And we do a consultation on site, person to person. That way we'll make an appointment and do an assessment and see if they need to go in an inpatient situation or if it's better to treat them in an outpatient situation. So it just gives the family hope, and we work with the family and the potential client.
Well, have you seen any outlier addictions? We just had another segment on internet addiction. Can you talk about those?
Yes, with addiction, of course, you can have a lot of co-occurring. It can be. We try to treat the most detrimental disease first. If that's addiction, we can also see a lot of co-occurring eating disorders as well, sex addiction and things of that nature. They just don't stop with the alcohol and drugs with our population.
And back to chemical treatment. Would you say that some parents would be hesitant in trying chemical treatments for addictions that involve illicit drugs?
Yes, and at Bradford we're an abstinence-based program, so when you say a chemical-based treatment, it may be a very short-term type of a detox when you're talking about that, or something that is not a narcotic that may not allow them to get the benefit that they would with a drug, but it would prevent them and also prevent the cravings. But we really believe we're a 12-step based abstinence program, so therefore we believe in the talk therapy and the group setting for treating alcohol and drug addiction.
Ms. Quadrani, how have you seen therapy help teens and adults?
Right now, post 30 days, we haven't had any of our residents return to treatment within a 30-day time frame, so our recovery rate's pretty good there.
And as for Bradford?
Well, it's really dependent upon the person. Bradford treats a lot of healthcare professionals and different professions with that. It's very trackable. That is very high when they have a program where they're monitored. And it's really based on what the effort that the person puts into it. So.
Well, Mr. Myatt and Ms. Quadrani, I hate to end our interview, but we're out of time. Thank you so much for coming on the show.
Thank you for having us.
Thank you. For more information about addiction treatment, you can contact Bradford Health Services 24-hour helpline at 901-755-8111. For Fairhaven Treatment Center, dial 901-244-4304. Addiction, especially in teens, is painful for both the victim and the family. I hope today we've shown you ways to recognize the signs if you suspect something is wrong with your teen and how to help treat them. Thank you to all the guests for joining us today. Remember, Crosstalk can be seen each week at 9:30 a.m. and 7 p.m. on Mondays, 9 a.m. and 7 p.m. Thursdays, and 7:30 p.m. on Sundays. For more information on our programming, please check us out on the web at GHS-TV.org, where we're streaming live 24 hours a day. You can also check us out on Facebook and Twitter. I'm Renee Mann. From all of us at GHS-TV, thank you for watching Crosstalk, and I hope to see you again.